Dear colleagues, I would like to present a case of vitreous bleeding which was supposed to be very simple. Unfortunately, in a moment it became a very complicated case. We all know about vitreous bleeding, and I'll skip that. I will just try to present this patient. That was a male, 80 years old. That was a history of long-lasting hypertension and a cerebral stroke, and he had a prostate surgery 2 years ago. That was a sudden painless loss of vision 6 months ago. The vitreous bleeding was not clearing up, so we decided to make a surgery. The surgical plan was to do a phacoemulsification because he had some degree of cataract, pars plana removal of blood, inspecting the periphery, laser photocoagulation and tamponade as necessary. When the blood was removed, the situation was very clear, and we can notice the small degenerative changes at the posterior pole. But this was the finding at the upper temporal periphery. There were some lumps which were absolutely unexpected, and that were the possible cause of vitreous bleeding. So we had several dilemmas. What to do? What are those lumps? And are they maybe malignant? The second thing was how to proceed with the surgery, because there was no discussion with the patient about any possibility of that, because the previous ultrasound didn't show something which was suspicious. And the third thing was how to remove those lumps from the eye, because they may cause vitreous bleeding if we cut in it, and they were very heavily vascularized, and they may be malignant. So the surgical plan was to do a deep diathermy or retinotomy around the lumps, to elevate the retina from the choroid if it is possible, to stabilize the rest of the retina with perfluorooctane liquid, to do a sclerotomy and to remove, to externalize the whole retina with those lumps, and close the sclerotomy, laser photocoagulation, and silicone oil injection. Now we have here the surgery. Unfortunately, the quality of the picture is quite poor because it is far on the periphery, and I do not have the possibility to work with my two hands, and so I am keeping the light probe in my left hand, and that is the reason why it is a very strong reflexes. But you will notice how the retina is cut and elevated. And now I have to determine the extent of the changes from the outside, so approximately in that region. I made a very big sclerotomy at pars plana. Trying to remove the retina with that. Unfortunately, as always, the opening is too small. We have to enlarge it a little bit. It is coming out now completely. And it is removed by venous scissors. Everything was finished, and you can see this is the final appearance 1 year after surgery. The anterior segment is completely okay, and as you can see, here is a bare choroidal region where the lesion was, and the retina looks quite okay. Sorry? The pathology, that was hemangioma. The pathology was hemangioma. But the pathologists were not quite sure about that. But fortunately, the patient didn't have any further problems. And as you can see, the retina looks quite okay. There is no detachment. There is nothing happened further. Thank you very much for your attention.
Thank you. So now we move.